Hello, my name is Umutoni Kanuma Sharon. I'm going to take you through EHR script. So, in general, I'm going to start by introducing what is EHR. So, this is known as electronic health records and is known as longitudinal electronic record of patient's health information that is generated by one or more encounters in any care delivery setting. So some of the patient's information that is recorded includes patient demography, progress notes, medication history, and laboratory data, and much more. So normally there are computer systems that are medical practices use instead of using paper charts. So this EHR system helps in performing of many fields in health practice since it acts as communication tool between the healthcare team and members, which helps in keeping data for a long time by making it easy to access anytime needed. So I'm going to move to the second part where I'm going to be talking about two components of EHR that support direct clinical care and they include so this has got a lot of components, including also clinical components, but still under the clinical components, they are found other subcomponents, and those include computerized provider order entry or CPOE component. This is used in helping the care providers to make and enter orders needed from their patients. It helps to help the providers in making the decision regarding their patients' orders, whether they have drug allergies, drug diagnosis, such things. So about the benefits and issues, starting with the benefits, it helps the prescribers to directly enter medical orders in a desktop computer or mobile devices and personal instance. It also provides a full-time access to patients' records and offer clinical decision support regarding to the accessing those information about the patient. It also helps the providers to minimize the errors where it alerts them to be aware of the errors like improper doses, allergies, and other potential risks. So about the issues is that the use of CPOE component as part of the EHR component, it has got more medication error risks associated with the system. Also, there are also common human errors such as knowledge deficit, distractions, inexperience, and typing errors of the workers. So moving to the second component, it's about laboratory component where it is much related to clinical since it deals with the way of capturing the results from the lab machines and integrating with orders and lab machines. There are benefits also and issues related to this component being part of EHR. So talking about the benefits, the first one is that it results from the laboratory and it can be shared with other providers across more than one healthcare organization since it's much more in electronic system. There is also reduced time spent and reduced errors related to transcribing process. So about the issues, the first one is the maintenance and the installation of this software is very expensive, and the second one is in the case of any small error, there is a big effect on the patient's medical system and also health. So, for example, if there is an error in the recording of the results from the laboratory, the patient is having a high risk of getting the medicine which is not related to the kind of a disease that they are treating. So talking about also the components of EHR that supports administrative process This includes billing system. So about the billing system, this helps a lot when it comes to the process of administering, since it gives the way of capturing all charges generated in the process of helping the patients in the payment process, either by insurance company or private. This is where the person pays for himself or herself. In addition to that, this helps the organization to track expenses, inventories, and their revenue cycle, since it was not an easy work before the establishment of the EHR. So about the benefits of this billing system is that it will be transmitted, the billing data is transmitted from the documentation system in the EHR documentation system to the billing company without entering the patient's data twice in the different systems, since we know that some other organizations are still using paper system and others have already migrated to this EHR system. So it avoids that recording twice in paper and electronic. So the second one is the billing system helps the therapist to focus on the patient and improve the clinic efficiency. The last one is that it reduces the coding errors, since once there has been the financial transaction, there is no over or less charging, and there are clean claims to be generated since they are electronic receipts done. Moving to the issues regarding this billing system, there is improper billing documentation maintenance by the providers. There are some times when the providers do not take care or do not take good care of the billing reports when they might be actually making decisions. The second one is that taking cash from the patients when not allowed. Like with this EHR, it is not allowed for the organization who operate under Medicare to accept cash from the patients regarding their rules, since it's not allowed at all for the providers to receive cash in hand from the patients. There are different ways that they are being paid. So another component regarding to the administrative, there is electronic documentation. This is also another component under clinical, under EHR component, which helps in documenting notes like history of physical discharge summaries, consults, and operative notes by using speech recognition templates or even transcription services. So about the benefits, how this benefits the organization is that there is use of electronic documentation. It's quicker than the use of human recording in the papers. It's time saving in case you are looking for a saved record on the computer rather than looking through a bunch of papers or a big, many different files while reading. So even the information is stored for a long time and can be easily accessed anywhere by the system. So issues related to this electronic documentation is that some important information may not be recorded when they are important. This is mostly done when some practices are changing from the system of using papers and starting to record using electronic system. You find that there might be some information that have been forgotten to be recorded once there was the process of changing. So another one is that some practices are scared of changing from paper charting to electronic charting, since it will be done as a double charting, and they think that it's a wastage of time. So moving to the last part of this script, I would like to talk more about the importance of integration, administrative and clinical areas for effective use of an EHR or electronic health record. So there are lots of importance about each EHR when it comes to the administrative and clinical areas. So some of these importances mainly include improved patient care, where there is improvement in the patient safety and prescriptions. The second one is increased patient participation. This is where the patients have to be collaborating with their providers, with their care providers through the EHR system in any decision made. So before they take any decision, those providers, they have to first inform or show it in the EHR system document that they share with their patients, so that even the patients can be part of the decision making. The third importance is that there is proved care coordination, where the team members of the organization have to limit themselves in the interaction made with the patient. Sometimes you find that when there is too much of interactions, you find that they are fragmenting the patients in different ways, or indirect or even direct cause it can happen. So the fourth importance is that there is improved diagnostic and patient outcomes when the care providers are able to access full health condition information of the patient. They can know how to handle the medication process. And lastly, which is the last point, is there is practice efficiency and cost savings, where the healthcare providers use EHR to help improve the medical practice management. So that was all about this EHR script. Thanks for following.